Hancock, of course, refusing to do our programme. He has been speaking on Sky News this morning.
This is unbelievable.
We talked about the issues with testing. We've talked about the issues with testing all along. Apparently, we have a world-beating testing system. Now we have people who are told that their local test is a 2-hour drive away. And I mentioned a person, Steve Hynd, who drove the 2 hours with his 2 sick children, ages 1 and 3, arrived and was told the testing centre had run out of tests. Well, Matt Hancock, the Health Secretary, has an explanation.
It's all our fault.
Yeah.
Not his. Watch.
We have seen an increase in demand, including an increase in demand from people who are not eligible for tests, people who don't have symptoms. If you're otherwise asymptomatic, like you or me, then there is no reason to get a test. We've had stories of, schools sending a whole year group to go and get a test, and that is not appropriate.
So it's all our fault. Of course I knew it would be our fault. I knew it wouldn't be Matt Hancock's fault. Of course his world-class testing system would be working perfectly if it wasn't for the public wanting tests. How selfish of them to be driving 100 miles with little children.
Well, let's speak to Steve Hynd.
It's all our fault. Let's talk to one of the people who's to blame for the test system crashing.
Steve Hynd, you got your 2 little kids, 1 and 3 years old, into your car to drive to a test site in Telford. 2-hour drive. And you were told when you arrived at the testing site what precisely?
So we arrived 5 minutes before our booked-in slot, and then we were told to simply turn around and go back home again. It was an incredibly mixed picture what was happening, very confused, a lot of people upset, but essentially we were told that the site was just closed. We were told that they'd run out of tests.
Steve, why did you want to have a test?
So for me, first of all, both my 2 young children had coughs, and so I was trying to follow the government advice. They'd said that if you have a new and continuous cough, you should go for a test. But I think it's just also a moral responsibility. If there's any chance of this track and trace working, we all need to go and have tests, and we need to make sure that happens. It's about protecting everybody around you, your friends and family. It's a moral responsibility, and you know what? The more that people struggle to go and have tests, the less that people are going to take advantage of it. Absolutely. The track and trace just has no chance of working for as long as it keeps messing up like this.
Steve, you have a very personal reason why you take COVID-19 very seriously. Tell us about that.
Absolutely. So earlier in the year, my dad passed away of coronavirus. He was very ill, had a lot of underlying health conditions. And the saddest thing about it was just not being able to be with him when he passed away. So him having to be in hospital by himself, surrounded by people wearing full protective clothing. And I mean, a tribute to the NHS staff and the people that looked after him at his care home before that. But yeah, the coronavirus stripped us of my dad and being able to be with him in the last weeks of his life. And ultimately, the incompetence that I see from this track and trace system is going to lead to more deaths. And I think we just need to be honest about that, and ministers need to be held to account for that.
So, Steve, when you hear the Health Secretary, Matt Hancock, explaining that part of the reason for the testing system being under pressure is because of an increase in demand, including from people who are not eligible for tests, who don't have symptoms. He says there's been an increase. Around 25% of people don't have symptoms and don't have a reason for it. Now, I'm not sure how they know that there's 25%, and I'm not sure where he gets his information from, but does that make you angry with those people who aren't eligible for a test who are going to get tested, or does it make you angry with the government?
So honestly, it makes me furious with the government, absolutely furious. I mean, the lack of clarity that they've been given in their messaging. We can't expect people to get this right when there are so many mixed messages coming out of government day in, day out. I mean, honestly, you need to be following this so closely to be understanding what people should and shouldn't be doing. And again, for people to have confidence in the system, they just need clear guidance and instructions of what they should and shouldn't be doing. And that simply isn't coming at the moment from government. And they need to do more. They need to be supportive and they need to be clear. And I just don't feel like that's coming from government at all at the moment.
Yeah, Matt Hancock has just been asked on the BBC about people going back to work, given the new guidelines. He says, not actively stopping people, but that is something we're worried about too. And then goes on to be ambiguous. Again, you know, what do you do? What do people do? Do they go back to work? Do they stay at home? It's constant mixed messaging, isn't it, Steve?
Absolutely. I mean, who knows? Are we meant to be getting on public transport? Are we not meant to be getting on public transport? Are we meant to be going back into the office? Are we not meant to be going back into the office? This coronavirus is too serious. I know that all too well for this level of incompetence, this level of mixed messages. And I'd say ultimately, I would encourage people to go and get tested if they have symptoms, if they're worried about it. Look it up and check what you should be doing, because we need collective buy-in for this. And ultimately, ministers need to take up and take some responsibility for this, because at the moment, what they're doing with this awful excuse of a messaging.
Yeah, and you make such a good point. On the one hand,
we
are encouraged to go and get tested, and on the other hand, the Health Secretary has just blamed people
for
going to get tested, and that is why we're running out of tests. They give with one hand and take away with the other, don't they?
And Steve, your father died in a care home where there had been multiple COVID-19 deaths. When you heard Matt Hancock and the Prime Minister boasting about the protective ring they put around care homes, how did that make you feel?
I mean, honestly, it makes me incredibly upset, Piers, incredibly upset. When I went to pick up my dad's possessions after he passed away from the care home, I spoke to the assistant manager there, and if I could get Matt Hancock to look into her eyes and see the level of hurt that she felt, because she felt so helpless to not be able to stop the people that she was looking after from dying. The level of hurt that she felt and how completely out of control she felt. It was utterly heartbreaking. And I mean, I just really want to pay tribute to the staff at the care home, because they were incredible and they were doing everything they could to look after their residents. But they were doing it again in a complete vacuum of information, and again, a complete lack of clear messaging from government. And if ministers aren't willing to take responsibility for that, who on earth is?
Well said, Steve. You know, I saw your tweets last night, and it started off as a story about this chaotic testing. And as they went on in your thread, I suddenly saw that your father had died of this, and I could understand then why your anger would be exacerbated. That as you try and protect your family
and
after the death of your father and the community, you're not able to do so. Steve, I really appreciate you joining us. It's been, I know, a lot of technical issues to get you on camera. It's been such a passionate and eloquent articulation of so many of these issues, and we're greatly appreciative to you. Thank you.
Steve, are you going to go back for a test? I mean, that 2-hour drive up there with 2 toddlers is a challenge. I mean, it's utterly hopeless, and I'm sorry that you had to go through that, considering as well what you've been through. But how do you get tested now?
So again, this morning, this is something I didn't know yesterday, but apparently they refresh the appointments day in, day out, early in the morning. So as soon as I get off the line from you today, I'm going to go and log back on and see what appointments are available. And again, it's a tribute to how utter shambles this is, that I've got absolutely no idea what I'm going to find. Is there going to be a testing centre down the road, or are they going to suggest that I drive halfway across the country again? I've got no idea, and how they expect people to follow this system, I've got no idea. And very quickly, Piers, I just want to say thank you to you as well. I feel like you've done more than most here in holding government to account on this, and it's appreciated, because I feel like there aren't those voices that are holding to people to account, and I think government needs to answer, and hopefully at some point they'll come and talk to you about it.
Well, I appreciate that. You know, one of the worst aspects of this is how we have this little ticker on our desk here, 134 days now since any member of the government came on this programme to be held for account. They don't want to be held to account, Steve. They certainly don't want to hear from people like you in their place on this programme, calling them out for a dereliction of their duty. And it's one thing to not come on here and to let down our viewers and to be derelict in that duty. But the way they've been derelict to what happened to your father and to you and your family, travelling all this way with 2 very young children, just to then be let down, that is a much more serious dereliction of duty. Yeah. And I'm very sorry that you've had to go through this. But listen, we will continue to hold this government to account because lives matter. Every life matters. Your father's life mattered. The death of every person in every care home mattered. And what concerns me now is a general atmosphere of chaos, inconsistency, mixed messaging.
And lack of resources.
And as a result, a lot of young people just not taking this seriously. And now we're seeing a spike in cases, a spike in hospitalisations and a spike in deaths, and it's worrying. Steve, thank you very much indeed.
Good luck today.
Thank you.
Sounds like you're going to need a lot of patience to get through that particular system. I hope the government was listening to that.
What a powerful and eloquent denunciation of so many aspects of what's going on right now.